Welcome back to Facebook Friday, Facebook Live. We're happy to be here talking to you about how to enhance your eyes. I'm Karen Whitney, physician assistant with Hope Mers, nurse practitioner. And today we're going to talk about a different segment. We've talked about Botox, we've talked about fillers, but what about your skin? We all know that skin under your eyes is different than the skin on your cheek. The skin on the upper eyelid seems to have a life of its own. It does its thing genetically almost in spite of what you do. So we're going to talk about some treatments. We're also going to talk about the fact that quite frequently patients come into us and they say, I need surgery for my lower eyes. They know they don't like how it looks and they feel like surgery is the option. And we're going to have another segment on surgery, but as you'll hear, often what we're trying to do is restore volume with fillers, smooth muscle activity with Botox, and today enhance the skin. So we will talk further about that ideal surgical candidate, but these other modalities almost always come into play. Would you like, Hope, maybe to talk about some of the procedures that we turn to for the eye area?
Yes. So we have a multitude of options for skin treatment, and I always tell patients, please don't ignore your skin. Botox and fillers can create such a great, virtually immediate result for fillers, and Botox takes a few days to start kicking in. Skincare is more of a process. So skincare is something that you do at home every day. It's something that you have to maintenance throughout your aging process, because skin begins to age in our early to mid 20s, really, which is depressing, but it does, and we lose collagen, our elastin breaks down, we collect dying cells in our skin, so we have to do things to really help stimulate collagen and slow that aging process. So, one great thing that I've used for a long time, over 10 years now, is just a basic microneedling. This is something easy you can do a few times a year. And what it does is this little pen. It has these 12 tiny needles that go in and out really quickly. They're so small that they're hard to even see. So it sounds kind of scary, these needles coming at you in a pen, but it's not. It's very tolerable. We put a little bit of numbing cream on prior just to make it as comfortable as possible. But what we do is we run it around the facial area. We can do the neck, the chest, the hands, stretch marks, anything that is kind of a textural issue, we can help with microneedling. It's really great for that under eye area, those little crinkles that won't come out all the way with Botox and fillers. And we typically recommend them in a series of 3. So we'll do them, September, October, November, 4 to 6 weeks apart. And then we reevaluate the skin. We see, do we need one maybe just once a year or twice a year? Sometimes people love it, want to do it 3-4 times a year. So that's a great option, low downtime, 2 days, you'll have little scratches on your skin, and then that heals up. Microneedling with radio frequency is another option. So this is where the tip doesn't actually go in and out as much. It goes in once and to the skin and sends a burst of radio frequency. That radio frequency energy tightens. So this is not going to affect small textural things as much as it will tighten and tone the skin. So it is great for that under eye area too, to tighten that looser skin, but also we use it for the neck and the jawline, so it's been awesome there. The third option you have is a dot laser. So dot laser is an effective treatment for that skin under the eye, around the mouth, those lines that we get around the mouth, really anywhere on the face, neck, chest for just skin integrity, and not only reversing skin aging, but preventing and treating a lot of sun damage too underneath the skin. So dot laser is typically done maybe every few years, and you have about a week downtime with that. So the first few days you might have a little swelling. You might not really want to go out and about shopping and things like that. But after that, really, it's just kind of pink. So it's not too much, you can go out, you can do your things, and no one will be like, what did you do? But that really helps reverse a lot of skin aging. I'm hoping to do that myself this winter, so.
Me too. So talking about procedures, I compare the skin to trying to stay in shape. And doing these procedures is like hiring your personal trainer and really hitting it hard. But skincare products could be the walking component of your skincare fitness. Because products are used consistently, you're in control of them, we're guiding you. Really, there are probably 3 components to an effective skincare program. One is retinol, or a retinol type product, and we know that retinols penetrate into the dermis and stimulate those cells to reproduce healthier and faster. So using a retinol, including gently around the eye area, is going to help keep your skin younger. Using an antioxidant like a vitamin C or some of the newer antioxidants is going to help prevent damage. It's going to help deal with reversing pigmentation and keep your skin healthier. And finally, using a collagen stimulator. One of my favorites happens to be the Elastin Restorative Eye Cream. We have biopsy photos showing collagen, new protein, and removal of that old damaged collagen. So that with regular use, this product is going to help keep the skin around your eyes looking healthier and support the treatments that you may have had in the office. The elastin can be used on the upper eye, which is a difficult area, and we'll talk more about surgical treatment of excess upper eye skin later. But these products are meant to be used consistently, regularly. You will see the results. Most skincare programs take about 3 months before you start to see the effect. So when you come see us, we're going to advise you which combination of treatments and products might be best for you, and how we can combine that with injectables or perhaps surgery to accomplish the best end appearance to enhance your eyes.
Yes, sounds good. One other thing, so with skincare, it's very customizable. So when you come in, we'll create a treatment plan, not only for today, but for years from now, so that you really know your, budget-wise, time-wise, because it takes time to come in and make your appointments and, really invest in your skin that way. But also, we can always include a little bit of something called Dermal Infusion. So Dermal Infusion is a facial procedure in which we have an instrument that exfoliates the skin and infuses a customized serum into the skin, and that can really help plump immediately. That's something great to do before events. So that's something that might go into action a little bit quicker for you. So if you're like, well, I got a wedding, in a couple weeks, I want my skin to look awesome, what can help me immediately? That's also a great option to do. So something like the Skin Medica Diamond Glow Dermal Infusion System, we can use that and really hydrate. It actually can kind of look like you got a little bit of lip filler and under eye filler, just a touch for your event. So that's one more thing that might be good.
Yep, I agree. I agree. Great. Well, join us for our next series. We look forward to talking to you about surgery.
Yeah.
All right.
All right. We'll
Thank
see you
you.
next time.